Can you do this stair test? It may predict your risk of dying of heart disease, cancer. For a glimpse into the state of your health just head for some stairs. How people perform on an exercise test that requires them to move very briskly can predict their risk of premature death from heart disease, cancer and other causes. A study presented Thursday at a meeting of the European Society of Cardiology found those with good, capable of high levels of physical exertion, say, on a treadmill, had less chance of dying early of any cause. The participants in the study underwent an exercise echocardiogram, but there's a much easier method to check your exercise capacity in a similar way. See if you can climb 4 flights of stairs at a fast pace, in under a minute, without having to stop, said Dr. Jesus P. Tiro, the study author and the cardiologist at University Hospital A Coruña in A Coruña, Spain. If you can do it, you have good functional capacity. If not, it's a sign you need more exercise, he noted. P. Tiro wasn't surprised by his study's findings. Physical activity has positive effect on blood pressure and lipids, reduces inflammation and improves the body's immune response to tumors, P. Tiro told Today. For the study, 12,615 participants with known or suspected coronary artery disease underwent treadmill, a medical test to see how well a person's heart tolerates activity. Their effort levels were measured in metabolic equivalents, or 1 met as it takes to sit quietly. Walking briskly requires about 3 mets, while jogging takes more than 6. This study defined good functional capacity as achieving a maximum workload of 10 mets. Being able to climb 4 flights of stairs in about 45 to 55 seconds would be equivalent to 10 mets, P. Tiro estimated. When the study participants were followed up over the next 5 years or so, each met they achieved during the exercise test was associated with a 9% lower risk of cardiovascular death, a 9% lower risk of cancer death and 4% lower risk of other causes of death, the European Society of Cardiology noted. In people with poor functional capacity, the death rate from heart disease was almost 3 times higher and cancer deaths were almost double compared to participants who had good exercise capacity. Cardiologists already know a patient who has a significantly abnormal heart stress test, but shows very good exercise capacity, has a better prognosis, said Dr. Andrew Freeman, Director of Cardiovascular Prevention and Wellness at National Jewish Health in Denver, Colorado, and a member of the American College of Cardiology's Prevention of Cardiovascular Disease Section Leadership Council. Freeman was not involved in the new study, but said it would encourage him even more to push his patients to and vigorously. He recommended 30 minutes a day of breathlessness. When people say, "I can't exercise because I'm short of breath," I say, "Great, what a wonderful thing. I want you to use that your advantage," Freeman said. "I want you to warm up and get right to that point where you're breathless, not passing out, but challenged. And I want you to stay there for as long as you can. Take a break when you need to and then resume." The 4 Americans say adults need at least 2.5 hours to 5 hours a week of moderate intensity exercise, or 1 hour, 15 minutes to 2.5 hours of intense activity every week. As for stairs offering clues to a person's heart health, doctors already ask patients whether they can go up a flight of stairs without symptoms before clearing them for major surgery, Freeman noted. Other tests found to predict longevity include being able to after sitting on the floor. Try walking, running, bicycling and swimming to boost your, P. Tiro advised. Freeman just wanted people to pick an activity they enjoyed that would make them breathless. "We know that in some ways exercise is a medicine and it has a dose response, where typically more exercise is better," he said.